COVID-19 is a major threat to food security in the Indo-Pacific region, as it is globally. Perhaps more so from indirect effects than direct effects. We saw with the Ebola crisis that there was a reduction in food production, but in this case it seems more likely that the bigger reductions will be in the ability to get food to market and logistical bottlenecks. Then the bigger risk is policy responses to COVID-19, for example, export controls and anything that impacts on trade in inputs and also in helping farmers get food to market. If those things come in, then as we saw in 2007 and 2008, there's a significant risk of shortages and food price spikes. There have been very important contributions in the last week from the Director General of the Food and Agricultural Organization of the United Nations, from the World Bank, from the G20 Leaders Summit, pointing out the importance of maintaining food supply chains and maintaining free movement of the essential food inputs, agricultural inputs, but also enabling smallholders to get their food to market. This will obviously be crucial for countries that import the bulk of their food, like Pacific Island countries. So the policy responses to COVID-19 will be just as important as the on-ground direct impacts of the virus. It's interesting that at the time of this particular crisis, aggregate food supplies worldwide are at historically high levels. So at face value, any acute shortages of food reflect distribution issues rather than production issues. Nevertheless, we know there are hundreds of millions of people who are still facing acute hunger, and there are about 2 billion people who have micronutrient deficiencies. Those tend to be the poorest people, with a disproportionate impact on women and children. So those long-running food security challenges that ACIAR was established to deal with unfortunately remain just as important as ever. And there's important intersections here between food security, the availability of fresh water, and human health. And so people who lack access to fresh water also have much more difficulty in staying free of the virus, in managing their personal health. And those three things tend to go together: lack of food, lack of access to fresh water, and health problems. ACIAR's been working on biosecurity measures for a long time, both with plants and animals. And ACIAR's done important research that's helped Australia, for example, to avoid and then minimise the impacts of, say, fusarium wilt in bananas, Newcastle disease in poultry, and now we're working on new projects around African swine fever in pigs that has a huge threat to protein supplies for many communities around the world. So, and we work not just in managing risks to Australian industries and the Australian community of potential incursions, but also in building scientific and policy capacity in our partner countries to help them better manage those risks. And we've had a very important plant biosecurity capability building project in Africa that's now being replicated across the Pacific. And I expect there's the potential for us to be doing more with our partners DFAT and others on zoonotic diseases like the coronavirus that's leading to COVID-19. This COVID-19 pandemic has arisen from a coronavirus. A coronavirus is a zoonotic disease that's a disease that crosses from animals to humans. And that requires us to look at the intersection of the human health system and the animal health system. And we're accustomed to spending a lot of money on human health surveillance and diagnostics and response. Typically we spend much less on the animal side of the equation, and yet in terms of risks, ultimately, as we're seeing with COVID-19, the animal health system is crucial for managing risks to the human health system. So there's a lot we can do with countries across our region to improve surveillance, diagnostics, risk management, response, and some obvious areas to zoom in on, for example, wet markets. And so we are planning work with our partners in the medium and longer term as to how we can ensure that COVID-19 is the last of these pandemics rather than just another in a long sequence of inevitable systemic risks arising from the intersection of human and animal health. COVID-19 is a global pandemic, and it is obviously demanding global responses. It illustrates that the importance of partnerships and collaborations almost like nothing before. So we are going to have to collaborate more deeply and more extensively to develop effective responses to this pandemic. We're working with our colleagues across the CGIAR, the International Collaboration in Agricultural Research, to ensure that donors are joined up in what we're asking of the scientists around identifying critical risks to both food systems and human health, and that we are joined up in our responses as well. So if anything, it underlines the value of the ACIAR business model of deep partnerships with our neighbouring countries and with our countries across the region, and the importance of scientific collaboration to ensure that we maximise both the efficiency and the effectiveness of scientific work tackling challenges to humanity such as this one.